Hi, welcome back to Pulamed. Today we will be discussing about horizontal gauge palsy. Let us look at the abducens nucleus at the level of pons. Here we have PPRF, that is paramedian pontine reticular formation. That is the one that gives impulses to the abducens nucleus, and from there abducens nucleus gives impulses to the medial longitudinal fasciculus. But why PPRF is giving impulses? That is because of the cortex. Cortex that is present is going to give impulses to the superior colliculus, and this will stimulate the contralateral PPRF. Look here what is happening to the abducens nucleus. The impulses that are being transmitted from abducens nucleus, they are going to the contralateral oculomotor nucleus via medial longitudinal fasciculus, and the impulses are being transmitted to the medial rectus muscle of that contralateral eye. Similarly, we have impulses that are being transmitted to lateral rectus of the same side by abducens nucleus. So that means if a person wants to look towards his left, so like how I am doing here, that means my left lateral rectus muscle should contract and also medial rectus muscle should contract. For this to happen, there should be activation of my left abducens nucleus, what we have discussed so far. So in case there is any problem with abducens nucleus or the thing that is going to stimulate the abducens nucleus, that is PPRF, there could be a problem with me looking towards that particular side. So there will be palsy of my left horizontal conjugate movement if there is any injury to left abducens nucleus or left paramedian pontine reticular formation. Just talk about 1.5 syndrome here. What is actually happening in this 1.5 syndrome? There is lesion in one abducens nucleus and second in the medial longitudinal fasciculus. See the diagram. I have mentioned in the diagram there is lesion in right adjacent nucleus and the medial longitudinal fasciculus that is arising from the left side. So what is happening because of the right nucleus? There is problem with right lateral rectus muscle, and there is also problem with left medial rectus muscle. And because of the lesion in the medial longitudinal fasciculus, we are having problem with right medial rectus muscle. Now, what is the only functioning muscle that is left? That is nothing but left lateral rectus muscle. That means the person eye, when he tries to look towards the left, only the left lateral rectus muscle will be moving, and there won't be any movement of the eye in the right side. Suppose if the person is looking towards the right, then what happens? There will not be any movement in the eye of the left side or right side. There should be four movements that should be working here normally. That is lateral rectus abduction in both eyes and medial rectus adduction in both eyes. But what has actually happened? Three of the muscles stopped working. So 1.5 syndrome. So what could be caused here? It could be ischemia or hemorrhage or trauma or demyelination. Anything that is affecting the region where we are having lesion in both the medial longitudinal fascicular and nucleus. Do share, like, and comment, and also don't forget to subscribe.